Good evening, everyone. My name is Daniel Chansa, and this is my cardiovascular soap note for this week. United States University 597 FNP course with Professor Aurelius. And my patient ID is VC, age is 52, male for gender, him pronouns, his race African American, insurance Aetna, marital status married with three children, two boys and a girl. Patient presents to the office this morning with his wife by his side. The patient is his own independent historian and reliable. Chief of complaint, patient has been having fatigue, reduction of exercise tolerance, irregular heartbeat, blurry vision, and a headache with some edema bilateral ankles. HPI, history of present illness. Patient is 52 years old, male, African American, presents with a 3-week history of fatigue, reduced exercise tolerance, irregular heartbeat, headache, especially to the back of the head. He reports of having intense headaches in the morning and improves throughout the day. Patient mentions blurry vision and edema bilateral to ankles. Denies of any dizziness or chest pain or shortness of breath at this time. The heart is irregular as described by the patient, a fluttering or skipping of heartbeat in the chest. Fatigue worsens with physical exertion and improves with rest. There are no other associating factors at this time. Using the old cards, patient describes the pain as onset 3 weeks ago, location, head and back of the head, some edema, bilateral ankles, and generalized fatigue. Duration persists the last 3 weeks. Characteristic: fatigue, dull blurred vision, headache, and heartbeat. Irregular beats. Aggravating factors are physical activity, lack of rest. Relieving factors, sitting down or laying down. The timing: severity starts in the morning and works itself throughout the day and persistent. Severity: headache is moderate to severe depending on what time of the day. Mornings are the worst. Fatigue and blurry vision, irregular heartbeat. Past medical history: general health, patient, no chronic medical condition, otherwise been healthy most of his life. Surgical history: had total knee to the left, 1998, post MVA. Hospitalization 4 days post-surgical of that repair. Preventative measures: patient uses acupuncture and yoga on a regular basis. Medications: takes 2 gummies daily, multivite for men. Uses CBD oil for sleep. Denies of any allergies from medications, food, or environment. Family history: mom and dad both have hypertension, diabetes. The mother has breast cancer, brother has obesity, and sister has breast cancer. Social history: patient is a monogamous with one wife, uses condoms for birth control, denies tobacco, alcohol, recreational drug usage. Spirituality: devoted Baptist, involved in community outreach programs with the church. For their diet, he enjoys eating eggs, cheese, and also is working on increasing his fruit, vegetables, and plant-based foods. Physical activity: patient walks 2 miles with his wife and a dog. Occupation is a night shift supervisor at Target distribution and shipping center. Home environment: they own a single home in Southern California, high desert. Patient uses for safety, uses seat belts, wears a helmet when riding a bike, has a home security system, fire detection, carbon monoxide sprinkler system. Holistic practices: patient uses herbs for cooking, tea, inhalation, essential oils for massages, and relaxation techniques. Review system: constitution, weight unchanged, no fever, chills. Patient has blurry vision, worsens in the morning. Ears: no hearing loss or tinnitus. With the nose and throat, no deviating septum in turbinates. No sore throat, no congestion, no difficult swallowing. With the cardiovascular, there's irregular heartbeats, denies of chest pain or shortness of breath, no cough with respiratory or wheezing or dyspnea. With the endocrine, no heat intolerance, no polyuria or polydipsia. Objectives: vital signs BP 199 on the first attempt over 107. Second reading was 160 over 93 to the left arm, and back to the right arm. The last reading was 155 over 89. Heart rate of 88. Temperature 98.6. Respiration 16. Oxygen 98%. Tonal air. Weight of 185. And height of 5'10". General appearance: patient is well nourished and in good posture. Well developed male in no acute distress. With the head atraumatic, no morphosalic. With the eyes perla. Does have blurred vision. With the tympanic membrane normal, no effusion. Bilateral ears. Cardiovascular rhythm does have no murmurs. Bilateral ankle edema. With the abdomen soft, tender, no hepatomegaly. With the extremities left and right ankle edema +2. Neurological: alert ×3, cranial nerves intact, no focal deficits. With the skin warm, dry, intact, no rashes or lesions. Assessment: primary diagnosis hypertension. Differential diagnosis: I have atrial fibrillation, sleep apnea, diabetes mellitus. Atrial fib can contribute to fatigue, irregular heartbeat, and edema bilateral, and also ineffective heart function caused by arrhythmias. Sleep apnea can worsen hypertension, causing similar symptoms of fatigue, irregular heartbeat. And diabetes can also have fatigue, edema to the ankles, and also can cause blood pressure changes. And my patient is going to get worked up with diagnostics. It's CT to the chest to rule out any pulmonary causes or symptoms. Blood work, including lipids, CBC, BNP, troponins, renal function tests, including renal electrolytes and A1C. ECG, EKG to assess fibrillation or arrhythmias. Chest X-ray to evaluate the size and stress on the heart, response to the stress. A CT, MRI of the heart to get a clear picture of the structures of the heart. Also continue to monitor blood pressure. The treatment: we're starting patient on medication losartan, 25 milligrams daily, hydrochlorothiazide, 12.5 milligrams daily, clonidine, 1 milligram as needed for blood pressure greater than 160 over 80. Recommendation: physical activity at least 30 minutes a day, low sodium diet, lots of fruit and vegetables, increase water intake, encourage exercise, educating patient on adhering to medications, maintaining blood pressure log and checking his blood pressure daily. Also discussing risk with the patient of hypertension, including cardiovascular stroke, also having kidney damages, diabetes type 2. Advise patient to monitor blood pressure at home and keep a log and bring it back on next follow-up visit. In about 2 weeks will be the follow-up to check on the blood pressure and also redraw the labs. If symptoms worsen, refer to cardiologists for further diagnostic and testing. Thank you for your time.